And if you decided 2022 is the year you're reevaluating your relationship with alcohol or your overall health, you may be kicking off the year with Dry January. Here to talk about this initiative and why the start of the year is a good time to kick the drinks, Dr. Joseph Volpicelli is joining me right now. He's the executive director of the Institute of Addiction Medicine. Doctor, thanks for being with us this morning.
Thank you for having me.
Well, first off, doctor, tell us a little bit more about Dry January if people aren't familiar with the term.
Yes, Dry January is a trend where people take the month of January where they abstain from alcohol and assess their relationship with alcohol. Some people during the pandemic, for example, have been gradually increasing their drinking, and this is a time to try to sort of take stock and see how you feel without alcohol.
And this could be someone who has a drink or two every day after work, or maybe only once or twice a week, or even a month, right? It's for anybody.
This is for anyone. This is to assess to see if you have a healthy relationship with alcohol. Alcohol can have bad effects at even lower doses, and so this is a chance to see how you feel without any alcohol in your system.
So what sort of outlook does someone need if they want to make this kind of change and they've decided, hey, I'm going to do this?
Yeah, so this is sort of a good time for people to assess to see how they're doing with their Dry January. We're well into the month. And for some people, they found it's relatively easy to give up the alcohol, and they're noticing some beneficial effects in terms of sleep, energy, overall how they're feeling. But for other people that are struggling, that they may find that they've been having a difficult time controlling how much they drink, or they start and stop, and they find that the alcohol is more of a problem than they realize. And for those individuals, there's some strategies to help them get back on track.
Well, let's talk a little bit more about those tools for folks who are struggling. And just because they are struggling, say you end up having a drink or two, it doesn't mean that you can't get back on that wagon, right? There's nothing stopping you.
Exactly right. So even if you've been struggling, it's still a good time to get back on track to see how you do. And there's various tools available to help people get back on track. First, I suggest that you get extra psychosocial support, maybe enlist friends and family to help you with the process. Then there's peer support groups that can be helpful. There's several resources available on the internet that you can use to help. And you may even consider getting some professional help.
Mm-hmm. And what other treatments are available for folks realizing that they definitely need some more help cutting back or abstaining altogether from alcohol?
Yeah, so for some people, they find that when they start drinking, they have trouble controlling how much they drink. So they can go all week without drinking, but on the weekends when they start drinking, they wind up having 4 or 5 or 6 alcohol drinks. And for those individuals, we find that there are certain medicines that can help to control the craving for alcohol and to help limit those binges.
And again, I think it is really critical to remind people time after time, just because you fall off for a little bit doesn't mean like with all New Year's resolutions, it doesn't mean if you break it once, you're done.
Exactly right. And there's various tools to help people get back on track. But this is just a great opportunity to assess your relationship and see if it's a healthy one.
And doctor, for more information, do you have a website folks can visit?
Yeah, so one could look at the Institute website, so instituteofaddictionmedicine.org, or you can go to our...
Thanks so much. We do appreciate it.